Spectravite Senior is a combination of vitamins and selected minerals that is used to prevent or treat vitamin deficiency. This can be due to poor eating habits, problems that affect the body's ability to absorb nutrition from food, or increased need for vitamins and minerals due to stress or illness. It contains high levels of B vitamins, vitamin C, as well as other vitamins, A, D, and E, and minerals such as zinc. It does not contain iron and has only a small amount of calcium. It should not be used to treat iron-poor blood, anemia, or to prevent osteoporosis. The recommended daily dosage and optimal timing for taking Spectravite Senior should be discussed with a healthcare professional. When taking Spectravite Senior, it's typically recommended to take it once or twice a day, as prescribed by your doctor. You can take it with or without food, but if you experience stomach upset, taking it with a meal may help. It's important to note that if you're taking certain antibiotics, such as tetracyclines or quinolones like ciprofloxacin, you should take Spectravite Senior 2 to 3 hours before or after taking the antibiotic. This is because the minerals in Spectravite Senior may interfere with the antibiotic's absorption. Some common side effects of Spectravite Senior include nausea, stomach upset, diarrhea, flushing, and an unpleasant taste. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor immediately if you experience any serious side effects, such as changes in mental or mood, or unusual weakness. While very rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you experience symptoms of a serious allergic reaction, including rash, itching or swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Spectravite Senior, it's important to inform your doctor or pharmacist if you have any allergies to the medication or any of its ingredients, such as folic acid. This is because the product may contain inactive ingredients that could cause allergic reactions or other issues. It's also essential to discuss your medical history with your doctor or pharmacist, especially if you have a history of low blood count, high calcium levels, kidney disease, or liver disease. Spectravite Senior is not recommended for use in children under 12 due to the increased risk of certain vitamins/minerals building up to harmful levels in the body. For pregnant women, it's crucial to only use this medication when clearly needed and to discuss the risks and benefits with your doctor. If you are breastfeeding, it's important to consult your doctor before taking Spectravite Senior as the drug can pass into breast milk. As always, it's important to follow the recommended daily dosage and take the medication at the optimal time for the best results. It's important to be aware of potential drug interactions with Spectravite Senior, as they may change how your medications work or increase your risk for serious side effects. It's best to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Spectravite Senior include altretamine, cisplatin, levodopa, hydantoins, such as phenytoin, methotrexate, and pyrimethamine. Be sure to discuss any concerns with your healthcare provider. When taking Spectravite Senior, it's important to follow the recommended daily dosage and consider the optimal timing for taking it. Be sure to consult with your healthcare provider for the best time to take this medication and the potential benefits it may provide. If someone has taken too much Spectravite Senior and is experiencing serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the US, you can call 911 or reach out to your local poison control center at 1-800-222-1222. Canadian residents should contact their provincial poison control center. Symptoms of overuse may include nausea and vomiting, dark urine, abdominal pain, yellowing of the skin and eyes, back pain, painful urination, changes in urine output, bone pain, mood changes, and severe headaches. If you or someone you know is experiencing any of these symptoms after taking Spectravite Senior, seek medical attention right away. As always, it's important to take medications only as directed by your healthcare provider and to follow the recommended dosage. Make sure to attend all your medical and lab appointments as recommended by your healthcare provider. It's important to note that getting your vitamins and minerals from healthy foods is the best way. Try to maintain a balanced diet and follow any dietary guidelines given by your doctor. B vitamins, including folic acid, can be naturally found in leafy greens, vegetables, and citrus fruits. Enriched grains like bread, pasta, and cereal also contain folic acid. Remember to include these foods in your daily diet to ensure you are getting all the essential nutrients. When taking Spectravite Senior, it is recommended to follow the daily dosage as directed on the packaging. It's best to take it with meals or as directed by your healthcare professional. Make sure to consult with your doctor before starting any new supplement regimen to ensure it's appropriate for your individual needs. If you forget to take a dose of Spectravite Senior, take it as soon as you remember. However, if it's almost time for your next dose, it's best to just skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. The recommended daily dosage for Spectravite Senior is 1 tablet daily with food. It's best to take it at the same time every day to help you remember. It is important to store Spectravite Senior at room temperature and away from light and moisture. Make sure to keep all medications out of reach of children and pets. Do not dispose of Spectravite Senior by flushing it down the toilet or pouring it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. It is best to consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.